In Nigeria, there are approximately 1.7 million children suffering from severe acute malnutrition. According to a 2015 UNICEF report, this number constitutes 1/10 of all severely acutely malnourished children in the world. The 2013 National Demographic and Health Survey indicates that the levels of malnutrition in northern Nigeria far exceed the national average. The percentage of children suffering from stunting and wasting is put at 59% and 17% for Jigawa States and 56% and 16% for Zamfara States. Malnutrition in northern Nigeria has complex interrelated causes associated to food security, caring practices, health services, and health environment. The Child Development Grant Program (Cdgp) is a 6-year pilot nutrition-sensitive program funded by the United Kingdom Agency for International Development (UKAID) and implementing in Jigawa and Zamfara States in northern Nigeria. The program aims to address poverty, hunger and malnutrition, which affects the potential for children to survive and develop. Cdgp provides monthly unconditional cash transfer of 4,000 naira to pregnant women from the time their pregnancy is confirmed until their children are 2 years old, targeting the critical first 1,000 days of a child's life.
It's strategic because the Nigerian Demographic and Health Survey of 2013 identified these 2 states as having the highest mortality and stunting levels of children in those 2 states compared to the rest of the region, and also in terms of the exclusive breastfeeding level in those states was also quite low. And so Save the Children, with the support of DFID, agreed that this would be a good state to consider for this program. So it was a strategic decision based on the need within those states and also where we could actually have maximum impact of the project.
We have discovered that the first 1,000 days are a unique opportunity to really invest in a child's well-being. So the Cdgp focuses on children before the age of 2 and provide them with cash transfers and education for their caregivers to have an impact on their development.
Alongside the monthly unconditional cash transfers, communities in the program are provided with nutrition education and advice through a social and behavioral change communication (SBCC) component. The combination of regular and predictable cash transfers and targeted nutrition social behavioral change communication are expected to contribute to improved food security and the adoption of beneficial practices and behaviors to support better maternal and child health. Cdgp is being implemented in collaboration with the national and state governments. The Cdgp theory of change believes that unconditional cash transfers and nutrition behavioral change communication are the key strategies to achieving the program outcome through empowerment of women, women control over income, change in attitude and perception, increased intake of nutritious food and improved health status, and ultimately improved health and nutrition. Since Cdgp's inception, the government of Nigeria has committed to implementing a National Social Safety Net Project (NASSP). The National Social Safety Net Project is developing the building blocks of a national safety net system and implementing a targeted conditional cash transfer.
The conditional cash transfer, the government set it up to address the issues of the absolute poverty, that is the poorest of the poor and also to ensure that the issues of vulnerability vis-a-vis poverty is addressed, being able to address income poverty of this particular set of group, that is the poorest of the poor, and also to enhance their capital development in order to facilitate their graduation out of poverty and also to break the generational poverty cycle.
We have learned from international experience that if you target cash transfers well and target the poorest communities and individuals, the cash transfers will always be used primarily to access food, but also additionally it will be used for their other basic needs. And this finding has been mirrored in our own assessments here in Nigeria. So really the design of the program allows them to access locally available nutritious foods and also take care of the other household needs.
The program has ultimately benefited 90,000 pregnant women, reaching over 630,000 persons based on population estimates of 7 persons per household.
The total reach of beneficiaries currently in terms of registration is 93,000 over 93,000 beneficiaries. And currently on a monthly basis, we've been able to reach between 96 to 97% coverage of beneficiary cash out on a monthly basis within 10 days in the program.
Muna yin work plan yadda muke zama da su ake bayani, saboda shi wannan shirin ba wai a ba mace kuɗi bane ta je ta kashe, a wannan a koya mata ilimin yadda za ta yi amfani da wannan kuɗin saboda ta tsira da lafiyarta da jaririn da take ɗauke da shi. A wannan IYCF ɗin muna yin health talk akan misali exclusive breastfeeding, shine dai daman daga zarar an haifi yaro ake so kar a bashi ruwa ya sha nonon uwa zalla har tsawon wata 6.
Cdgp beneficiaries now think it is best to start breastfeeding immediately or within 30 minutes of birth.
Lokacin da na haihe ta a asibiti na haihe ta cikin minti 30 na ba ta nono. Sannan kuma lokacin da mun ka dawo gida an dan ba ta gudunmawa irin haka, ba a ba ta ruwa sai dai nono. Ba abun da ake ba ta in ba nono ba.
Tun da aka haife shi ba a ba shi ruwa ba, kuma an haife shi lokacin da ana buƙatar a bai yaro ruwa kafin minti 30. An ba shi nono ya sha, kuma an ba shi nono a tsawon zuwa wata 6 ba a ba shi ruwa ba. Yanzu kuma an fara ba shi wata 6 da kwana 5. Lalle yaron nan ya samu lafiya sosai, baya kashi, baya zazzabin nan, baya tari, yana lafiya. Haka ma na ƙaru da ilimin aikin. Ilimi shine na samun yaro mai inganci, ba rashin lafiya ba komai, lafiyar shi ƙalau.
Da ba na komai, amma yanzu ina sana'a, ina kuma da abun kiwo. Ina siyar da gyada da gero da dawa. Akwai rago guda 3 yara da kuma mamansu guda 1. Ina ɗinki ma. Ina da keken ɗinkin shi ma na siya duka a cikin wannan shirin, a cikin wannan kuɗin da ake tallafa ma mata masu ciki da kuma ƙananan yara. Gaskiya sun taimaki rayuwana sosai. Sun yi taimako don kowa ma an ya gani ya zo ya gani haka ma zai sha'awa na ma, shi ma sai ce dama shi ma haka, shi ma sai ce dama shi ya samu wannan abu, shi ma yadda zai yi haka.
Kanka a rufe baka ganin kowa, shikenan sai aka zo aka fito da kai aka waye ma kake ganin ko ina. Alhamdulillah zuwa asibiti kullun ne, in dai wannan lokaci yayi kamar Laraba din nan kullun ba mana tunani asibitin nan na mai addu'a kai daga nan har Dutse, daga kan zuwa asibiti alhamdulillah mun samu ci gaba. Kuma ko a Dutse bana tunanin fayil din dogon dawa, tun daga kan wannan ainihin wannan polio da ake yi, kaga yanzu ma kun zo kun samu aikatan aikin polio a nan. To ko bana nan in aka zo nan babu wanda za a je yi wani taurin kai ya ce ba za a masa ba. 100% mun samu ci gaba alhamdulillah.
Gaskiya a da a wata a datar mu ta wata bai fi mu samu 100 ba, amma yanzu muna samun 400, ko 50 kin ga an samu ci gaba.
Mu a da ba a san ba da amfaninsa, ka gani inda in aka haifi yaro sai a yi kwana 2 ko 3 ba a bashi ba nono ya tsotsa wannan kalkali he an tatse shi ana zubarwa ana tatse shi ana zubarwa, to ba mu san ba ashe shine babbar garkuwa a jikin yaro. Ka gani ana son wannan nono mai yalo ruwan ɗorawar wannan na farko yaro ya same shi shine komai na ƙarfin gwiwa na fusa'ar kwakwalwar yaro da ƙwarin jiki da fusa'arsa zai tashi da ita in ya sha wannan kalkali na fari.
The Cdgp has a complaint response mechanism for its beneficiaries to feedback in the event of grievances and complaints.
For us in Cdgp, we have different form of complaint channels. We have the male VRGs and we equally have female VRGs. We have the complaint toll-free line, and we also have they can raise complaint through staff, they can raise complaint through CVs, through any other stakeholders, and anybody within the community can raise complaint using this avenue I listed.
The midline evaluation of the Child Development Grant Program (CDGP) conducted by the EPACT Consortium investigates how the program has impacted maternal and childcare practices, health status, food security, and nutrition status of children and mothers. The evaluation has shown that from inception till date, a period spanning 5 years, CDGP has registered over 93,000 beneficiaries, covered over 1,000 traditional wards in 143 intervention communities, reached over 1 million people, beneficiaries and other residents in action-oriented groups, for example, food demonstrations, nutrition awareness sessions, and mass media, improved the practice of exclusive breastfeeding, which is 70% in CDGP implementing communities compared to 20% in non-CDGP communities, improved antenatal care attendance among pregnant women, which is 36% in CDGP communities compared to 20% in non-CDGP communities, and enabled 52% of mothers in CDGP communities to feed their children from at least 4 different classes of food instead of carbohydrates only, compared to 40% in non-CDGP communities. This has enabled stunting in CDGP communities to be at 65%, while it is 71% in non-CDGP communities.
CDGP has reached over 88,000 people with health education, 72,000 during food demonstrations, 36,000 during support group meetings, and 31,000 during one-on-one counselling.
Beyond the output or what we are delivering, we've been also supporting the Jigawa State government in developing their own social protection policy that was finally endorsed, and Social Protection Council was created at state level, which is chaired by the Deputy Governor. The state is currently working on developing their own social protection program, which I believe is one of the major achievements of this project.
CDGP has demonstrated the ability to implement a cash transfer plus nutrition intervention at scale, the flexibility to work in a rapidly changing implementing environment, the capability to reflect and incorporate lessons to improve program implementation, and the aptitude to influence policy agendas and encourage uptake of social protection at federal and state levels.
We have seen significant impact in the limited areas that has been applied, especially in terms of the nutritional aspect and in terms of the insistence that pregnant women go to antenatal and so on. The conditional aspect of it has interested us, and we have committed to expanding this program with technical assistance from Action Against Hunger to about 10 other local governments. This, I believe, we have actually budgeted funds for. And some of the pictures we saw before the advent of this program were really startling. I'm glad to say that that incident has reduced. We're working closely with the Ministry of Health to validate some of the figures so that we can create justification in expanding this to, like I said, 10 other local governments in the first instance, and then all over the state subsequently.
CDGP actually has tremendously achieved a lot in the state. You see, prior to Cdgp, we had an idea that if a little stipend is given at that lower level, at the community level, it could have a strong impact, particularly in the issue of nutrition, but we had no evidence. It's just some kind of presumption. So the Cdgp actually come up with the evidence, which is clearly seen with the grant they gave to the pregnant woman. Over a long period of time, we see the health status of this woman has improved, particularly the maternal health. We have seen evidence of nutrition because the issue of stunting and wasting is declined significantly in the areas which there are intervention. And within the technocrat, we have seen capacity that is being built over time at both state and the local level, and even at the community level. You see the well-organized volunteers working, and that has significantly improved the interpersonal relationship within those communities.
We rely on Cdgp for much of the design of this program. The learnings from our community-based targeting in terms of community entry strategies, advocacy, we're using entire structure and learning from Cdgp.
Government's adoption of the program will ensure sustainability of social protection for women and children when the program closes out in 2019.
We have already introduced information on nutrition to caregivers in and around the country, in the states where we've already begun the training. But of course, nutrition is an issue. It's really bad in certain states. So we're trying to see if we can persuade those states, the 6 or 7 states, to really adopt it as their co-responsibility. But that does not mean that we don't have cases of malnutrition, stunting, and waste in many other states.
We are already doing that. I'll give you an example for the unconditional cash transfer program that the federal government is adopting. We have already finalized plans, which starting from next month, to begin to use that platform also as a means to disseminate some of the information, the same information that is being applied in terms of the child development grant. Give them simple pamphlets that will talk, teach them about the benefits of proper nutrition while you are pregnant, the benefits of exclusive breastfeeding, and also to encourage a saving culture, just like we have seen in the CDG program.
We have developed a social protection policy, and that is by a way will help in institutionalizing the social protection. And secondly, I think based on the evidence generated and other communities that has not been involved, we have seen a lot of demand. The state government on its own has approached us and requested that the government is ready to inject 1 billion as a start to see how it can implement its own targeting of that 1,000 days with a view to see the outcome and possibly scale it up. As I'm talking to you, we have prepared the budget, how it is going to be implemented, and the submission is with His Excellency, awaiting his approval so that we can actually use the Cdgp lesson learned and implement our own program. And very soon it will come to effect. My advice to those states that actually have not been implementing the social protection program, particularly targeting the 1,000 days, is that investing in children at that level is really not only a social protection, but it is an investment which actually generates higher return than most of the investments within our system. And to let them know that for us, we are really committed to scaling up this program because we believe in and we are committed to the underlying principle that the program support.
To conclude, first of all, I would like to thank the government. We received tremendous support for this project. From inception and all along of the project phase, they contributed both time, energy, and even financially. They gave financial contribution to this project, which I believe is important to be noted. And we're really grateful, we're really appreciative. We're happy to continue partnering with them, and we hope that, all the learning, and I talked about it earlier, that we managed to gather during the project implementation will be useful for the government of Nigeria, for other state government, but also other development partners, and maybe possibly beyond Nigerian borders, to set up other projects of this type, trying really to get social protection to break through and become the norm and the standard and being implemented at scale all across the Federation.